Hi, so today we're actually going to talk about neuropathy, which also known as nerve pain. And a lot of people come into our office that have that nerve pain in their feet or their hands. They don't quite understand how they got it and what it's made up of. And there's actually 4 things that have to be addressed that most doctors miss. Hi, I'm Dr. James Parsons with Premier Chiropractic, and we've been helping people with nerve pain / neuropathy for years. So the first thing I want to talk about is what's happening to your nerves. So when you're starting to get that numbness or burning in your feet and it's starting to hurt, that's typically where we'll see it first, is in the feet, and then eventually it can get in the hands. So if you got it in both areas, you've got it pretty bad. We want to get you in it sooner than later. So let's talk about this up here. So there's a little yellow nerve coming out right here, and then there's a protective covering to protect that. That's called the myelin sheath. And that myelin sheath is a living, breathing tissue. And we know all tissue needs oxygen and nutrients. And the only way that happens is good blood supply. So this is a nerve, a very healthy nerve. So over time, either due to, typically what we see a lot of people in is type 2 diabetes. It could be some nutrient deficiency, or even chemo type therapy can cause damage to the vessels. And so as you see here, we're starting to see a narrowing of the blood supply, which is decreasing oxygen and nutrients to this tissue that's protecting the nerve. And so what happens is as this damages, then that nerve starts to become kind of like a live wire, if you will. So imagine this coating. This wire actually has no coating on it. What's going to happen to that nerve? Well, it could spark, it could cause fire. Well, in the foot, it's actually going to be more of a burning sensation because that nerve is no longer protected by this coating, as you can see here. Now, when the patients come in, one of the things that we're going to do is do a detailed neurological exam to evaluate which nerves are being affected. So if you'll take a look over here, we can see the different types of nerve types that we're going to take a look at. One is going to be the large nerve fibers. And those, when you're starting to get those affected, what you're going to see is balance issues or light touch issues. The symptom is going to be lack of stability, loss of balance, sensitive to the feet. So these patients usually coming in, they're walking with a cane, or if it's gotten worse, they start to actually have to use a walker, or they're usually coming in with somebody bringing them with a wheelchair. And then the small fibers we're going to test. That's going to be your sensations of cold. So you'll see tingling, cold feet, pain, or numbness when you're starting to get the smaller fibers affected. On the C fibers, that's going to be your warm and hot, and that's the burning and itching sensation that you're starting to experience. So also we're actually going to start off and do an infrared laser scan of your extremities and see what they look like to actually show whether you have decreased blood supply or not. So that's a really cool test that we have incorporated. And I'll actually include a picture on that so you guys can see the blue color is poor circulation. Red is great circulation. So if you or one of your family members is starting to experience that burning sensation, nerve pain in your feet or your hands, give us a call and let's see if this might be the right approach for you on what we do here. You have a blessed day, and I look forward to hearing from you and your family.